One of my specialty areas is eating disorders, and the basic passion that comes from that is it's just a long history as a gymnast. 18 years I was a gymnast, and growing up in the gym, you see a lot of folks struggling with eating disorders, struggling with body image issues. So I have a real respect for how difficult that struggle is. So from that base as a gymnast, I went on and I learned as much as I could about it through all of my training and experience, and now kind of feel more and more comfortable working with other professionals, medical doctors, nutritionists, and my part as the psychologist to provide the best treatment as possible. As a coach, parent, teacher, a friend, if you're concerned about a friend for related to an eating disorder, things you might notice, people might kind of eat some of their dinner and then rush off to the bathroom or something like that. They might be losing weight pretty significantly or gaining weight pretty significantly in a short period of time. And if you're concerned about them, one of the things I'm going to encourage you to do is really pay attention to the behavior that you're noticing that's really concerning you. So things like, hey, I noticed that you dropped a lot of weight recently. How's everything going? Are you doing all right? Or I noticed that you haven't been eating dinner with us as a team recently or as a family, and I noticed that. I'm really concerned about you. How's your eating? How are you feeling about your body? Although there's a small percentage of folks out there with eating disorders, our feelings about our body, being uncomfortable about how we're doing with our body, is very common. To be able to approach somebody and just talk about how the things that you see that you're concerned about, and be able to know the professionals that maybe they might be able to see, like a counselor or a psychologist or Ohio State sports medicine, to be able to talk to them that way. I think that could be helpful. Some things that pop to my mind, things that you shouldn't say to somebody with an eating disorder: try to avoid fat talk, like that person's fat, or that person looks chubby, or these kind of ways. These are kind of trigger words sometimes for folks with eating disorder. Make them think about themselves, and if you think that they're fat or chubby, even if you don't, using that language around folks with eating disorders can oftentimes be detrimental. Oftentimes we focus on health. We focus on being the most healthy you can, as opposed to the weight. We talk about eating healthy choices, using healthy coping mechanisms. It's about health and wellness, as opposed to something that's really not helpful is to say, why don't you just eat? What's the problem? Just eat. So one of the main ways that I think about eating disorders is that it's a way to cope with things that are difficult in our lives. It's one of many ways to cope. So a lot of our focus becomes on food, and that consumes our mind, and that helps us in some ways cope with more difficult stressors in our life, say the death of a loved one, or a lot of pressure related to work or school or sport. And so it's just one of many ways. So when we start to view it as a coping mechanism, there are many coping mechanisms for things that are difficult in our life. That's one of them, and my job is to help you find many other options that you can choose from to help you through your life.